Hello. Today we're going to talk about diseases and disorders of the eyes. First of all, we're going to talk about the orbicularis oculi. These muscles create blinking and closing of the eyelid, not movement of the eyeball. So the orbital muscles, or A, B, C, and D, and you can see them right here, they're more on the outside of the perimeter of the eye. The preseptal muscles are E and F, which are right here, and the pretarsals are G and H, which are right here. So this is like more on the eyelid itself. The extraocular muscles rotate the eyeball in the orbits and allow the image to be focused at all times on the retina. So you have the superior and inferior rectus, lateral and medial rectus, and the superior and inferior obliques. Common signs and symptoms of the eye are pain or burning, decreased visual acuity, which means you just can't see, visual disorders such as flashes of light, and eye redness. Now let's talk about some disorders of refraction. Okay, so myopia is also called nearsightedness. The cornea it's either that the cornea is too curved or the eyeball is too long. The refractive power of the lens is too weak. Okay, it could be any of those three. Now, the eye is naturally spherical in shape. Under normal circumstances, when light enters the eye, it refracts evenly, creating a clear view of the object. Myopia develops as the eyeball grows, so it starts in childhood and worsens during the teens. Normally, it stops getting worse in adults. So in myopia, the image focuses in front of the retina. Okay, so this is what I have. So I can see close, but I don't see well as my far vision isn't as great. But as I got older, that actually changed. My near vision got worse, but I can see better far away. Now, hyperopia is another word for farsightedness. Now, the eyeball is too short, the refractive power of the lens is too strong. Okay. And this is what people see. So they don't see close, but they can see far. The light is focused behind the retina. And then we have astigmatism. Okay. The eyeball of a person with an astigmatism is shaped like a football or the back of a spoon. The light is refracted more in one direction than the other, allowing only one part of the object to be in focus at one time. Okay. The irregularity of the corneal surface leads to blurring or halos. So you see the cornea in a normal eye is round, whereas in an astigmatic eye, it's more like a football. Okay. And this is what a person sees with astigmatism. The cornea is egg-shaped and the light rays are unevenly focused across the retina. So it's hard to see close or far. Presbyopia. This is age-related farsightedness. It's a loss of elasticity of the lens. The cornea and the lens focus light reflected from objects. The ciliary muscles adjust the lens. So they lose near vision. So as it becomes less flexible, it can no longer change shape to focus on close-up images. So when you look in the distance, the ciliary muscles should relax, and nearby they should contract. And so they lose this elasticity. Nystagmus is an involuntary, repetitive, rhythmic movement of one or both eyes. It can cause by brain tumors, cerebrovascular lesions, congenital nystagmus, or abnormal development of the nervous system. Strabismus. This is in an abnormal deviation of the eye. The weakness of the extraocular muscles controlling the position of one eye. Okay, so we have these three types. So in Esotropia, this is cross-eyed, one eye turns inward. In Exotropia, this is also called divergent strabismus, one eye turns outward. And in Hypertropia, there's an upward deviation of one eye. In Hordeolum, this is also called a sty, which is right here. This is a localized, purulent, inflammatory staphylococcal infection. It affects the sebaceous gland in the eyelid. And I used to get these whenever I had my finals. I don't know what it was, but it seems like the more stressed I got, the more I got these styes. And a chalazion, this is a small, hard, cystic mass on the eyelid. It's caused by a blocked up, inflamed meibomian gland. And these glands are located on the eyelids. They produce an oily secretion which slows evaporation of your tear flow. Keratitis is an inflammation of the cornea. It may be caused by viral, fungal, or bacterial infection or trauma, and it's often caused by a viral infection with HSV, herpes simplex virus. Blepharitis, this is an inflammation of the margins of the eyelids involving hair follicles and glands. This usually occurs when tiny oil glands located near the base of the eyelashes malfunction. When oil glands malfunction, bacterial overgrowth can result, leading to inflamed, irritated, and itchy eyelids. Now, it may be infectious or irritation. And irritation could be, like, say, by the wind. Entropion, the eyelid turns inward so that the eyelashes and skin rub against the eye surface, causing irritation and discomfort. It occurs most often in older people and in women more than men, and it is usually only on the lower eyelid. Ectropion, the eyelid turns outward, and it's usually the lower eyelid. This leaves the inner eyelid surface exposed and prone to irritation. Occurs mainly in older people and affects men more than women. Conjunctivitis. This is an inflammation of the inner lining of the eyelids. It may be infectious or due to irritation such as the wind. It's also called Pinkeye, and this is a highly contagious infection. Now, the organism that causes this is Haemophilus influenza subtype Egyptius. Blepharoptosis. This is a permanent drooping of the upper eyelid. This is caused by a weakness in the third cranial nerve, which is the oculomotor nerve, or muscle that raises the eyelid. A corneal abrasion. This is a scratch on the transparent anterior cellular layer of the eye. It may be produced by foreign bodies such as dirt or dust that are trapped between the cornea and the eyelid. Also, interned eyelash, or blepharitis, which is an eyelid infection. The episclera. Okay, this is a vascularized, loose connective tissue that connects the sclera to the conjunctiva. There's the episclera right there. And then we have episcleritis. This is an inflammation of the episclera, which is the connective tissue between the sclera and the conjunctiva. It looks similar to pinkeye, which is also called conjunctivitis, but there is no discharge or tearing. No apparent cause, but is usually associated with systemic inflammatory conditions such as arthritis, lupus, and inflammatory bowel disease. A cataract. Now, this is opacification of the lens, okay? And that just means that the lens is cloudy, okay? Light rays entering the eye get dispersed in an unorderly fashion. This causes glare, foggy vision, and reduced visual acuity, most often due to age-related changes in the metabolism of the lens. Normally, the crystalline lens of the eye and its capsule is clear and allows ordered refraction of the light rays to the retina so that we see everything clearly. Cataract is a state of opacification of this crystalline lens of the eye. Okay, see how cloudy it is? And normally the light just comes in and centers on the fovea centralis. Well, because of that opacity or cloudiness, the light rays just disperse. So instead of seeing clear, you get this cloudy vision. Okay, so we're going to stop there.